Do 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 do. Do 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 do.
Hi, I'm Jennifer Lyall.
I'm Dr. JJ.
And welcome to Vitamin Junkeys, where we're addicted to health. Today we're going to be talking about osteopathy.
Because Jen has grown a full foot since the last time we filmed. So we're going to talk about osteopathy. Yes, today we're talking about osteopathy.
We've made a few modifications to the set just to compensate for
Jen,
my
grew
height deficiency.
poly-juiced potion.
I've been taking calcium supplements.
Calcium, there we go. She's been taking these pills, but 50 of them a day, which you shouldn't do at home. Anyway, this is a calcium, magnesium, and vitamin D pill, which fits very well with our theme today, which is osteopathy. So I take this on a daily basis, and this is very good. For premenopausal women, you should have about 1,000 milligrams of calcium a day, and for postmenopausal women, you should have about 1,500 milligrams of calcium a day. Best taken with magnesium and vitamin D. So down the hatch. There we go.
And it's important that you do need those other minerals because those are necessary to digest, for your body to process the calcium.
Yes, ma'am. Yippers.
Okay. And we have a special guest with us today as well.
Woo! This is Laura Disenhaus. She's a good colleague of mine. I hold Laura in very high regard, and she's also very tall.
I just grew about 6 inches.
She just grew.
Yeah.
Special polyjuice potion too.
Special osteopathy.
Special osteopathy. She extended her fascia. And,
that's right. The potion.
I'm on a tangent. So Laura is a physiotherapist, and also she is in her thesis year of studying osteopathy. So when we start off with Laura, can you tell us what is osteopathy for people at home?
Well, I get asked that all the time, and because of osteo, people always ask, does that have to do with bones? Like, are you cracking bones all the time? And actually, osteopathy, it's a huge field in alternative health medicine that has to do with bones, of course, but actually we're dealing with the entire architecture of the body. So it's not just bones and joints, which of course we deal with, whether it's the spine or the elbow, the knee, the extremity joints as we call them, but it's also to do with all the connective tissues that hold the joints and the bones together. Of course, all the muscles that attach to all the bones, and the fascia, which I was saying is actually connective tissue, which lines all the bones, and actually then everything in between. So we have all the abdominal organs, which are attached through connective tissues to the bones, to keep them suspended so they don't fall to the ground with gravity. And we also deal with something called craniosacral therapy. So it's actually a huge field of manual medicine.
So what does it treat? Like, who would come to see an osteopath?
Lots of different people would come to see an osteopath. So typically we get people who complain of things like headaches or jaw pain, low back pain, neck pain, all the classical things that people would go to a physiotherapist for, or a chiropractor, or ask their GP who they should go to get some treatment for some pain relief. But also people who complain of even something like digestive disorders, because as long as they've already consulted their doctor, of course, to find out there's no organic cause to their problem, or seen their naturopath, right, of course, often some sort of vague digestive complaints, or even with women menstrual complaints, are actually due to a malpositioning of some of the ligaments that suspend some of the organs. So there's actually a mechanical relationship between some complaints that we don't normally think of as being sort of mechanically oriented, like the ones that I've just discussed. So those are things. Children are, very amenable to treatment. Colicky babies, for example. Often when babies are going through their, thank you very much, the birth canal, when they're going through the birth process, they sometimes, because part of the process is there's an extension movement of the head, and it can actually get jammed way in the back, and that can actually compress one of the main nerves that innervates all our digestive organs and cause constant digestive discomfort with these. So they just start crying. Is that you? And so they just start crying all the time. We can fix that.
It's funny, when I ride my bike and my neck hurts, maybe it's me going back to the birth canal.
It's an old birth injury. You're going through.
I'm going back
remembering.
To I'm rebirthing.
Yeah, we can give you a somato-emotional release.
Really?
No.
You do that?
That's something else. Something else.
Well, the good example is I've referred people to Laura with uterine fibroids, bladder problems, back pain, TMJ, memory problems, a whole slew of conditions. And normally, I would say about 90% of the time, I have someone. I take care of the inside stuff, and Laura and her colleagues take care of the outside stuff, which works really well. So hand in hand. So.
So it's about rebalancing, right?
Yeah.
There's just all kinds of things that we're basically an accumulation of the traumatic events in our lives, not just emotionally. I'm talking about the physical
she
events.
Grew. She must have like huge
That's a whole new issue. We need some
Fascial.
treatment for you.
fascial tears,
We have
stretches.
to treat it to accommodate
Adhesions.
the changes. Exactly.
This is the lingo. Adhesions.
Adhesions.
Fascia. Well, fascia, you know what I always tell the patients about
What?
fascia is the silver skin stuff you see in red meat that kind of allows people to get that. It's like saran
Yeah.
wrap in your body. Kind
That's right. I use that analogy too. You know, when you're cooking with chicken, around the chicken breast, that thin, slimy film. It's
Yeah.
actually thicker in us, but that's what connective tissue
So
is.
we're thick messes
Thick as a
of
brick.
slimy
Yeah.
scales.
So where can I find a
Very sexy.
naturopath? How
That's
sorry,
naturopath. Right over here.
Osteopath,
Right there,
you,
To
and then
right.
you refer me
Left.
to her,
Left.
osteopathic practitioner.
Well, or you could go see her directly. The osteopathic practitioner over here and physiotherapist, Laura Disenhaus.
But thanks for the plug. But if you want to find an osteopath, sometimes the easiest way is to call the Canadian College of Osteopathy. They're the oldest and the main college for osteopaths to graduate from. Or you can call the Ontario Association of Osteopaths, which is our professional organization, and they can tell you who's either, you can go to see someone who's still going through the program, people who've gone through their third, their fourth, there's 5 years altogether. They've got a lot of knowledge, you can go to see them, and then...
So you're very smart than 5 years.
No, I've just got a lot of endurance,
She's very endurant and smart.
Endurance.
Modest too.
Endurance. And then after 5 years we have to do a thesis, and then we get our letters. So they don't have to find someone who's absolutely completed the program to get a practitioner who could be very useful to them. But if they call this Ontario Association of Osteopaths, they'll give them a list of people and what year they're in and where they are in the process.
And you'll be able
Sure.
to find that through the Find a Practitioner link on our website, www.vitaminjunkies.com. Wow, Laura, I've learned a lot from you today. Thank you so much for sharing all of that. I never really knew what osteopathy was.
Well, thank you for having
We
me.
should get you to do some stuff on you.
Yes, we'll see a little demonstration of it
Some
in
magic.
action as well.
Cool. You got a high
Very
five.
good.
Take a
All
high
right.
five.
Hey,
All right.
You good? Oh, you got a high five. Sweet. High five behind
This
you.
is like
Good.
a
High five
childhood
before.
game.
there you go.
Come on.
Thank you so much for joining us. Please log on to our website and you can join The Addiction where you can sign up for our weekly podcasts. I'm Jennifer Lyall.
I'm Dr. JJ. Sorry, just forgot who I was for a moment. And continue the addiction to good health.
Continue the addiction to good health.
Do 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 do. Do 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 do.